Assalamu alaikum, Dr. Shid Mahmood here. Steroids are used in pediatric age group in multiple conditions, starting from allergies, asthma, and autoimmune disorders. So, these are given for a longer period of time. At the end, we do tapering. So, question usually is asked that when we need to taper off these steroids, why we do taper off this steroid, and how to taper off this steroid. So, we will answer these three questions in this video. First is that when we need to taper off steroid. So there is no exact cut of limit for the tapering of steroid, but it is usually recommended that if you use steroid for a period of more than 1 week, then you have to taper off these steroids. Second question is that why we need to taper off this steroid. The answer is that it basically, when we provide a steroid, mostly steroid is that is prescribed is prednisolone, so it will mimic the function of cortisol, that is natural hormone produced by our adrenal glands. So it will eventually lead to suppression of this hypothalamic pituitary adrenal axis. The adrenal gland will rest and will not perform its proper function for the time being when we are giving steroid from the external source. So it has to restart. For that, it need time. So we will taper off steroid so that the adrenal gland can restart its function and restart producing its steroids. The third question is that how to taper off steroid. So again, there's no set rule for this, but generally recommended that if you're giving a dose that is more than 20 milligram, then the dose above the 20 milligram will be tapered off as a 5 mg per day. The dose between 20 to 10 mg will be tapered off as a 2.5 mg per day, and below 10 mg it will be tapered off as a 1 mg per day. No, we will discuss like scenario. Suppose a patient is taking a tablet delta bottle that contains 5 mg per tablet, and it is a prednisolone, and patient has a dose of 40 mg. So how will you will taper? I already told that the about dose about 20 mg will be tapered as a 5 mg per day. So the dose of initial 20 mg will be tapered off over the period of 5 days. The dose between 20 to 10 mg will be tapered off as a 2.5 mg per day, so it will be tapered off over the period of 4 days. And below 10 mg dose will be tapered off as a 1 mg per day, so we will taper it over the 10 days. So total patient will need the duration of 19 days to taper off this 40 mg tablet. In practically, sometime we do rapidly taper off. Instead of tapering 1 mg per day below 10 mg, we do tapering it as a 2.5 mg per day. But recommendations are so. Thank you.